I'm gonna try to recall some of the procedures for nursing skills. So this one is a kit that we use for urinary catheter insertion. So I'm gonna focus on how to wear sterile gloves. So basically, first I need to make sure that the size fits me. Again, if it's too large, it's too small, it's not gonna fit. This is not really the good one we have. There's one that actually like shows like because in the sterile field, right, there's like an inch you can actually touch. So this one doesn't have it. But in order to wear a sterile gloves, I'm just gonna pretend doing it. So you have to like don your non-dominant hand first by pinching the insides. The inside is not non-sterile, and then once you don the non-dominant hand, you can actually don your dominant hand, so you can insert your glove left hand and it kind of like make sure you fit the right finger and it kind of like adjust it if necessary. So that's how to do it. And then this one is the manual way of measuring the blood pressure using a sphygmomanometer. This one, again, in order to use this one, make sure it's calibrated, make sure your patient is sitting comfortably with dangling dangling legs. Make sure they're not really like what they call crisscross, and make sure that the inflatable is released, there's no air, and make sure the blood pressure cuff is properly sized. It can't be too tight, and it tells you on the actual cuff like where to put it in the left or right arm. Again, before you start, make sure you try to like locate the brachial artery of the person, and then also if you can't find it, worst case scenario, you can use the radial to actually, because that's the thing that you're gonna use to actually like locate the systolic and diastolic pressure. So this one again, if you actually like make sure it's released all the way, and when you before you pump it, right, make sure you close all the way and kind of like do that. And then once you don't hear the pulse anymore, then you add like 20 to 40 mmHg millimeters of mercury in that one, and then release it slowly. And but at the same time, make sure you control it, or else you're not gonna hear anything because it's gonna go down fast. The first pulse you're gonna hear will be the systolic pressure, and then if you go along like all the way down, and then the second one will be the diastolic one, and then after you hear the diastolic, you can release it like all the way. So this one is the instruction. I've never seen. Again, it also explains you the procedure of how to do. Because this one, like you have to know how to use the manual blood pressure in first semester of nursing. All right, guys. Thank you for watching.